Good evening. Welcome to Monday Reading Live. My name is Vandana PS, one of the reading trainers from Needus Academy. So how was your weekend? Exam ഒക്കെ എങ്ങനെ ഉണ്ടായിരുന്നു? Okay. So we have exams coming this week as well as in the another week. അല്ലേ നവംബറിൽ നമുക്ക് I think 3 dates are there. So as usual, I'll give you a sample question from part B. Then let's discuss about part A in detail. Okay, so I'll give you 2 minutes for the completion of this sample question from part B. Here comes the question. All right, so welcome back. Good evening once again. Hi, good evening, Sanila, Megha, Shanta, and Neeta. Yes, good evening. Okay, so how was this question? Engane undairunnu question? This is not a very tough sample question from part B, but yeah, this is just like your exam model question. Okay, so I'll read the question, then we will discuss the answer. All right. So the question is like, what does the extract talks about musculoskeletal injuries? Okay, so in the previous classes or in the previous videos, I was dealing with a lot of explanations regarding part B as well as part A. And In very detailed manner, I have explained about part B. So, first of all, when you read a question, as you guys know, you should read the question, underline the keywords and understand the question. That is the first thing. Okay, I can say the most important point is understanding the question. Question മനസ്സിലായില്ലെങ്കിൽ എന്താ പ്രശ്നം? We will not get the correct answer. So, the most important thing is understanding the question. Clear? Hi, Josna. Good evening. Yes, Shiny. Good evening. Yes, I'm good, dear. My exam was okay. Listening part A, extract 2 is difficult. Yeah, let's see. Hoping for a positive result. I'll let you know once the results are out. Okay, of course. Okay, I'll be waiting for that. Yes. Yeah, so let's hope for the best. Okay, Shiny. So, yeah, what about the question? Coming back to this question. So, what are the keywords from the question? What does the extract talks about? Musculoskeletal injuries. So, as you can see here, the category is not mentioned in this question. Question category just mentioned like an extract. Okay, so extract in the it will be from any kind of document. For example, manual extract, notice extract, okay, email extract, or a guideline extract. So whatever extract, a piece from the entire portion. So that is an extract. And here, what are the keywords which we have? It is extract, then musculoskeletal injuries. So these are my keywords from the question. Okay, so there are no important keywords. I can't say so because there are keywords. Musculoskeletal injuries. So when you read a question, always connect with your options. നമ്മൾ options ആയിട്ട് connect ചെയ്തെപ്പോഴും വായിക്കണം. Otherwise, it will be confusing. Clear? Okay. So what is option A? And before that, understanding the question, one point is remaining. What is it? Which category of question is this? This category of question. Hi, Divi. Good evening. Yes, Divi, can you tell me in the comment box which category of question is this? Comment cheyamo. This question category aanu. What category of question is this? What does the extract talks about? Musculoskeletal injuries. Is it a guideline extract, or it is from the second category, manual or policy, or it comes under the third category, whether this is an email or a memo or a notice? Which category? Any idea? The category of question aanu. Because the category is not mentioned here. It's all about musculoskeletal injuries in adults as mentioned from the heading in this paragraph. So, yeah, so which category of question? The question category aanu. No idea? Okay, let's see. So, what about option A? Musculoskeletal injuries. Non-opioid treatment is one amongst the others. So, my keywords non-opioid, then amongst others. Okay, and what about option B? Opioids prescribing rates have prolonged in current years. So my keywords, prescribing, then prolonged, current. Option C, 1/5 of the musculoskeletal injuries were treated in the OP. So 1/5, then treated, OP. So these are my keywords from these three options. Okay, so this is like you should underline the keywords from the question. Don't be overconfident. Okay, നമുക്കൊരു പ്രശ്നമുണ്ട്. എന്താണ്? When you are doing materials daily, നമ്മൾ എല്ലാ ദിവസവും material ചെയ്യുമ്പോൾ that overconfidence will be there inside us. Okay, that's not good. Okay, ഇതൊക്കെ എനിക്ക് അറിയാവുന്നതല്ലേ? There is no need for underlining the keywords. അങ്ങനെ ഒരിക്കലും വിചാരിക്കരുത്. Don't ever think so. Because whenever you do the material with your first time intention. അല്ലെങ്കിൽ നമ്മൾ ആദ്യത്തെ ഉദ്ദേശം എന്തായിരുന്നു? With the same intention you can approach a question. Okay, നമ്മൾ ഫ്രഷർ ആയിരുന്നപ്പോൾ എങ്ങനെയാണോ മെറ്റീരിയൽ അപ്രോച്ച് ചെയ്തത്, വിത്ത് ദ സെയിം ഇൻറ്റൻസ് ഓർ വിത്ത് ദ സെയിം ഇൻറ്റൻഷൻ യു ക്യാൻ അപ്രോച്ച് എ ക്വസ്റ്റ്യൻ. ഓക്കെ, എങ്ങനെ ക്വസ്റ്റ്യൻ വായിച്ചു, വാട്ട് ആർ ദ കീവേഡ്സ്, അണ്ടർ ഹൗ യു ആർ അണ്ടർലൈനിങ് ദ കീവേഡ്സ്, ഹൗ യു ആർ റീഡിങ് ദ പാരഗ്രാഫ്. സോ ആസ് വെൽ ആസ് വാട്ട് എവർ ഓർ വാട്ട് യു ഹാവ് ഡൺ ഇൻ ദ പ്രീവിയസ് ഓർ വാട്ട് എവർ യു ഡൺ ആസ് എ ഫ്രഷർ, യു ക്യാൻ ഫോളോ ദ സെയിം. എന്താണോ നമ്മൾ ചെയ്തുകൊണ്ടിരുന്നത് അത് തന്നെ ഫോളോ ചെയ്യുക. ഡോണ്ട് ബി ഓവർ കോൺഫിഡൻറ്റ്. ഓൾ റൈറ്റ്. And coming to the category of questions, so here, as I already informed, this is all about musculoskeletal injuries in adults. So I can tell you this is all about maybe that, yeah. So whatever, what kind of or what category of question is this? This is the category aanu. Yeah, quite different answers. Hi Megha, yes, guidelines. Okay, Mohanida, it's a manual. Okay, Priya from the third category. Yes, Ansi, guideline. Yes, Shanta, it is a notice. Devi, guideline. Okay. So ella categories undu. Anyway, what is the correct category? Which is the correct category? I'll start from the first category, guidelines. So what are guidelines? And as you guys know, guidelines, which means a set of rules and regulations, something we should follow. നമ്മൾ നിർബന്ധമായിട്ടും ഫോളോ ചെയ്യുന്ന കാര്യങ്ങളാണ്, that will be in a guideline, right? So it's a guideline. So where or what are the set of instructions mentioned here? എന്തൊക്കെ ഇൻസ്ട്രക്ഷൻസ് ആണ് ഇവർ കൊടുത്തിരിക്കുന്നത്? These and these are the instructions, or അല്ലെങ്കിൽ they should follow this type of instructions. So where is it mentioned? Any kind of instructions? No. Okay, so this is not a guideline. This is not a guideline. Okay, then so we can say this is not from the first category. This is not a guideline. And what about second category? Second category we have manual and policy. So is it a manual? Manual, which you know, it's a small booklet about a particular medicine or a machine, device, instrument, equipment. Okay, so what kind of equipment is mentioned here? What kind of a device is mentioned here? Any machine is mentioned here, or a medicine is mentioned here? No. So this is not from the second category, not a manual, not a policy, not from the second category. So like Priya said, yes, Shanta and yes Priya, it is from the third category. Okay, maybe this is not a guide, email or a memo, because there is no sender mention nor receiver mention, so that you can categorize into the final one from the third category. Maybe this is a notice. Either a notice have a chance on. Okay, so from the third category, maybe this is a notice. And what are you reading for in a notice? We are reading for the purpose. So what do you mean purpose? Purpose, which means the overall idea, the intention. എന്താണ് അത് സെൻഡ് ചെയ്യുന്നത് അല്ലെങ്കിൽ പ്രൊവൈഡ് ചെയ്യുന്നത് കൊണ്ടുള്ള ആ ഒരു ഉദ്ദേശം. Okay, the overall idea, the purpose. And which lines are important? All lines are important, but I can say you can just give a special focus to the last lines. Okay, or the last paragraph. So what is in the last? That is important. Okay, so that's all about the question category. Now we are reading the paragraph here. Musculoskeletal injuries in adults. Alright, musculoskeletal injuries are common and are frequently treated in outpatient settings. In 2010, they accounted for more than 5 million healthcare visits in the United States, and 4 or 5 injuries that were treated in a physician's office were musculoskeletal injuries, accounting to $176.1 billion in 2010. Okay, so from the first para, can we select any option or can we eliminate any option? And as you guys know, we are applying the method or the strategy called elimination here. We are using a strategy and elimination method or elimination strategy. So with the help of elimination strategy, can we eliminate any option from the first paragraph? ഏതെങ്കിലും ഒരു ഓപ്ഷൻ നമുക്ക് എലിമിനേറ്റ് ചെയ്യാൻ പറ്റുന്നുണ്ടോ from this first paragraph? So here in the second line, more than 5 million healthcare visits in the United States and 4 or 5 injuries. See, 4 or 5 that were treated in a physician's office, that means OP, were musculoskeletal injuries accounting to $176.1 billion in 2010. So that means it is tracing towards option C, but it is not 1/5, it is 4 or 5. Okay, so that means it is contradictory option, or I can say opposite option. Clear how we are eliminating? This is called elimination. So along with reading, you should eliminate. നിങ്ങൾ വായിച്ചുകൊണ്ടിരിക്കുമ്പോൾ തന്നെ eliminate ചെയ്ത് പോകണം, otherwise it will be confusing for you. Clear? Okay. അപ്പോൾ ഇവിടെ 1/5 of the musculoskeletal injuries were treated in the OP. This is contradictory, or this is an opposite option when you compare with the question as well as the paragraph. Alright, and what is in the second paragraph? Acute musculoskeletal pain lasts less than 4 weeks and includes strains and sprains, soft tissue injuries, then whiplash and various other conditions. Numerous treatment options exist, including non-pharmacologic and pharmacologic interventions. For what? Injuries. Question is related to injuries. For the injuries, we have numerous, a lot of different types of treatment options exist, including non-pharmacologic. What do you mean non-pharmacologic? Pharmacology, which means the medicine. Non-pharmacology, which means surgery, for example. Okay, and pharmacologic, medicine interventions. In the United States, approximately, so from that line, I can trace towards which option? I can trace towards option A. Non-opioid treatment is one amongst the others. So what is the others mentioned here? But others എന്ന് പറയുന്നത് എന്താണ്? Numerous treatment options exist. Okay, including non-pharmacology plus where എന്താ ഉള്ളത്? Pharmacologic interventions. Okay, so non-opioid. Opioid is a medicine, pharmacology. Non-opioid treatment is available, which comes under non-pharmacologic. Okay, in the United States, approximately 1/5. So here comes a keyword exactly from option C, 1/5 of patients. What is mentioned here? Patients. Here it is mentioned 1/5 of injuries. Again, contradiction. Representing with pain in the outpatient setting receive an opioid prescription for acute musculoskeletal injuries such as ankle sprains are common. As of 2015, 2 million persons had opioid use disorder involving prescription opioids, although prescribing rates have decreased in recent years. Okay, so already I have eliminated option C because of contradictory or opposite option. And what about option B? Opioid prescribing rates have prolonged in the current years. What about prolonged, which means? What does it mean, the word prolonged? Yeah, let me know in the comment box. What do you mean by prolonged? Yes, Megha, understood, ma'am. Yes, Megha. It's option B. Okay, answer is option A. Okay, Shanta. Yes, elimination method, option A. Yeah, option A. What is the meaning of the word prolonged? Prolonged. It is a very common word as you can see in your OET exams. അല്ലേ നമ്മൾ എല്ലാ എക്സാമിലും കാണുന്ന very familiar, very common word is prolonged. So that means for a long period of time. Right? Yes, long time. Very good. So where is it mentioned? Opioids prescribing rates have prolonged in recent years. It is decreased in. So here prolonged, which means increased for a long period of time. Here it is mentioned it is decreased. So again, contradictory option or opposite option. So that our answer is option A. When you get the correct answer, always bubble the letter. Okay, നിങ്ങളുടെ ആ ലെറ്ററിൻ്റെ ചുറ്റും it will be like a circle. So you can bubble the circle like this. നിങ്ങൾ ആ bubble ചെയ്യുക circle. Okay, so this is how you are identifying the answer and bubbling the correct answer. Clear? That's all about a sample question from part B. Okay, any doubts? Is it clear for you? Yes, decreased period. Very good, Megha. Yes, Divi, long time. Yes, Megha, long time. Yeah, answer is option A, exactly from the last parallel. Okay, very good. So that's it. Clear? That's all about that. So now we are moving to the main part, which is part A. So we have a self-prepared material here, which is a new material. Okay, yes, it is biliary atresia. Okay, biliary atresia. So we can, let's do one thing. Let's read the material, underline the keywords from the material, then we will move to the question answers. Okay, yes. So what about the material? It is a very easy material because this is the first day after your exam. Okay, നമുക്ക് എല്ലാ മാസവും എക്സാംസ് ഉണ്ട് ആസ് യു നോ, ആൻഡ് ദിസ് ഇസ് ദ ഫസ്റ്റ് ഡേ ആഫ്റ്റർ യുവർ എക്സാം. സോ ഇന്ന് നമ്മൾ സ്റ്റാർട്ട് ചെയ്യുമ്പോൾ മേ ബി ഐ തിങ്ക് ഓൺ ദ ലാസ്റ്റ് ഡേ റിസൾട്ട്സ് വർ പബ്ലിഷ്ഡ്. സോ ഒത്തിരി കുട്ടികൾക്ക് മേ ബി റീഡിങ് ടഫായിരിക്കാം, മേ ബി റീഡിങ് ഇസ് ഡിഫിക്കൽട്ട് ഫോർ എ ലോട്ട് ഓഫ് സ്റ്റുഡൻസ്. സോ അവരും ഈ പറയുന്ന ഒരു ലൈവ് സെഷൻ അറ്റൻഡ് ചെയ്യുന്നവരുണ്ടാവും അല്ലേ. സോ ഡെഫിനറ്റ്ലി ദേ വോണ്ട് ടു റീസ്റ്റാർട്ട്. ഓക്കെ, ഇപ്പം നമ്മൾ റീസ്റ്റാർട്ട് ചെയ്യുമ്പോൾ എന്താ ശ്രദ്ധിക്കേണ്ടത്? ഡോണ്ട് ഓൾവേസ് ക്യാരി എവറിത്തിങ് ഫ്രം ദ പാസ്റ്റ് വെൻ യു റീസ്റ്റാർട്ട് സംതിങ്. നമ്മൾ എന്തൊക്കെ പാസ്റ്റിൽ ഉണ്ടായിട്ടുണ്ടോ അല്ലെങ്കിൽ പാസ്റ്റിൽ കണ്ടിട്ടുണ്ടോ അതൊന്നും പിന്നെ തിരിച്ച് കൊണ്ടുവരേണ്ട കാര്യമില്ല. ഓക്കെ, വെൻ യു റീസ്റ്റാർട്ട് സംതിങ്, സ്റ്റാർട്ട് വിത്ത് എ ഫ്രഷ് മെറ്റീരിയൽ. ഓക്കെ, സോ എല്ലാ കാര്യങ്ങളും ഒന്നും കൂടെ നമ്മൾ പഠിക്കുക. ജസ്റ്റ് റിമൈൻഡ് അബൌട്ട് എവറിത്തിങ്. Okay, and refresh everything. So we are just restarting today. Okay, so we have a new material here, which is biliary atresia. Yes, so I'll read the text, then I will underline all the important words from this full text, then we will discuss the answers. And as you know, today I'll give you an overall idea regarding what is part A. Okay, so why we are doing part A? What is the importance of part A in our day-to-day activity? Okay, so what is the importance of part A? Within a set of time or a short period of time, they are just trying to identify whether this aspirant or the student is able to find out the 20 questions or 20 questions of questions within this ഷോർട്ട് പീരീഡ് ഓഫ് ടൈം. ഈ പറയുന്ന ഒരു ഷോർട്ട് പീരീഡിൽ 20 ക്വസ്റ്റ്യൻസ് കംപ്ലീറ്റ് ചെയ്യാൻ സ്റ്റുഡൻറ്റ് ഏബിൾ ആണോ? വെദർ ദ സ്റ്റുഡൻറ്റ് ഇസ് ഏബിൾ ടു ഐഡൻറ്റിഫൈ 20 ക്വസ്റ്റ്യൻസ് വിത്തിൻ ദിസ് ഷോർട്ട് പീരീഡ് ഓഫ് ടൈം. Okay, and what is the relevance here? എന്തിനാണ് ഇങ്ങനെ ഒരു പാറ്റേൺ ഓഫ് ക്വസ്റ്റ്യൻസ് കൊടുത്തിരിക്കുന്നത്? ബിക്കോസ് they just want to analyze the student, whether the student is able to do a particular procedure or a particular, how the student is able to handle a particular scenario in a hospital. ഒരു പുതിയ ഹോസ്പിറ്റലിൽ നിങ്ങൾ വർക്ക് ചെയ്യുമ്പോൾ ആ ഒരു പർട്ടിക്കുലർ സിനേറിയോ എത്രത്തോളം വെൽ ഹാൻഡിൽ ആണ്, അല്ലെങ്കിൽ എങ്ങനെ നിങ്ങൾ ഹാൻഡിൽ ചെയ്യുന്നു എന്നുള്ളതാണ് പാർട്ട് എ അനലൈസ് ചെയ്യുന്നത്. ഫോർ എക്സാമ്പിൾ, ഇഫ് ദ ഡോക്ടർ ജസ്റ്റ് വാണ്ടഡ് യു ടു ഡു എ സാമ്പിൾ ഫ്രം ദ പേഷ്യൻറ്റ്, അല്ലേ? അപ്പോൾ നിങ്ങൾക്ക് അറിയില്ല, എന്ത് ചെയ്യും? ഇഫ് യു ഡോണ്ട് നോ അബൌട്ട് ദ പ്രൊസീജിയർ, ഇഫ് യു ഡോണ്ട് നോ വാട്ട് ടു ഡു, വാട്ട് വിൽ യു ഡു? ഓക്കെ, സോ ഡോണ്ട് ബി അഫ്രൈഡ് ഓഫ് ദാറ്റ് പെർട്ടിക്കുലർ സിനേറിയോ. എന്ത് സിറ്റുവേഷൻ നമ്മുടെ ലൈഫിൽ വന്നാലും വി ഷുഡ് ഡീൽ ഇറ്റ്. നമുക്കത് നേരിട്ടേ പറ്റൂ, അല്ലേ? സോ ലൈക്ക് വൈസ് വി ഷുഡ് ഡു വൺ തിങ്. എന്താ ചെയ്യാൻ പറ്റുക? വി ക്യാൻ റീഡ്. വി ഹാവ് എ സ്കിൽ കോൾഡ് റീഡിങ്. Okay, so with the help of that, we can fast read a particular, maybe a soft copy or a hard copy from the hospital. You can go through the procedure, collect important words. So, okay, what about the time mentioned? What is the numbers mentioned there? And just collect overall idea, apply to the patient. This is what we are going to do. We don't have to seek help from the others. Okay, എപ്പോഴും നമുക്ക് എല്ലാ പ്രാവശ്യവും മറ്റുള്ളവരുടെ ഹെൽപ്പ് ചോദിച്ചുകൊണ്ടിരിക്കാൻ പറ്റുമോ? Of course not. ഓക്കെ, സോ വി ഷുഡ് ഫൈൻഡ് ഔട്ട് അവർ ഓൺ വേ. നമ്മുടെ സ്വന്തം വഴി നമ്മൾ തന്നെ കണ്ടുപിടിക്കണം, അല്ലേ? യെസ്, അതിപ്പോൾ ലൈഫിലാണെങ്കിലും നമ്മുടെ പ്രൊഫഷനിലാണെങ്കിലും ഇറ്റ് ഈസ് കമ്പൽസറി. ഓക്കെ, സോ നോബഡി ഈസ് ഗോണ ഹെൽപ്പ് യു. സോ please do find out the answer by yourself within the short period of time. So that is part A is gonna analyze whether the student is able to identify a set of questions within a set time. All right. So, what is in part A? How many questions? Already I mentioned 20 questions in part A. Okay, 20 ചോദ്യങ്ങൾ ഉണ്ടാവും, 20 questions in part A. And what about the time? Out of 1 hour exam, we are spending exactly 15 minutes for the completion of part A. Okay, 15 minutes തന്നെ എടുക്കണം യാതൊരു നിർബന്ധമില്ല. If you are a very talented student in reading, you can complete the question within 8 minutes, maybe 6 minutes. It's up to you. Okay, but don't take more than 15 minutes. നിങ്ങൾക്ക് എടുക്കാൻ പറ്റില്ല because they will collect your papers. Okay, so the maximum time you will get is 15 minutes. Okay, എപ്പോഴും നമ്മൾ ആ ഷാർപ്പ് ടൈമിന് വേണ്ടി വെയിറ്റ് ചെയ്യരുത്. എന്ത് ചെയ്യുക? എന്ത് ചെയ്യണം? You can do one thing. What? Hi, Tanka Sudha. Yes, good evening. So you can do one thing. Always do one thing in the ഒരു 2 minutes നമ്മൾ എപ്പോഴും റിമെയിൻ ചെയ്യുക. വൈ? ബിക്കോസ് ദാറ്റ് 2 minutes will help you to just read it once again. Okay, എൻ്റെ ആൻസേഴ്സ് ഒക്കെ ചെക്ക് ചെയ്യാമല്ലോ. Okay, I can check my answers once again. So likewise, you can check your answers within the 2 minutes of time. Okay, yes. So coming back to this one, and for the completion of part A, here we need a strategy. നമ്മൾ എന്ത് കാര്യം ചെയ്താലും if it is in a proper structure, if it is in a proper strategy, everything will be all right. എല്ലാം നല്ല ഭംഗിയായിട്ട് ചെയ്യാൻ പറ്റും, അല്ലേ? So likewise, when you do part A, if you guys are doing in a very, in a proper structure, or if you guys are doing with a proper procedure or a strategy or a method, definitely you can score 20 out of 20. Okay, and what is the strategy we are using there? നമ്മൾ എന്ത് strategy യൂസ് ചെയ്യുന്നത്? That's called skimming and scanning. Clear? That is called skimming and scanning. So ഞാൻ ഓൾറെഡി പറഞ്ഞിട്ടുണ്ട്, നിങ്ങൾ ഒരുപാട് വീഡിയോസിലും ഒരുപാട് പേരുടെ ടോക്കിൽ നിന്നൊക്കെ നിങ്ങൾക്ക് അറിയാൻ പറ്റുമായിരിക്കും. മേ ബി യു ഗൈസ് നോ അബൌട്ട് സ്കിമ്മിങ് ആൻഡ് സ്കാനിങ് ഫ്രം എ ലോട്ട് ഓഫ് വീഡിയോസ് ആൻഡ് ത്രൂ എ ഡിസ്കഷൻ. സോ വാട്ട് ഇസ് സ്കിമ്മിങ്? സ്കിമ്മിങ് വിച്ച് മീൻസ് ഫാസ്റ്റ് റീഡിങ് സംതിങ്. Okay, within a short period of time, exactly I can say you can spend 2 minutes for the completion of skimming and scanning. Correct 2 minutes time set ചെയ്യുക, skim and scan. I'm not saying about freshers, okay? Freshers-ൻ്റെ കാര്യമല്ല ഞാൻ പറയുന്നത്. For the experts, you can just put a timer for 2 minutes, then skim and scan. Freshers എന്ത് ചെയ്യണം? If you're a fresher, don't put the timer because you will get confused. So first of all, get in a contact with what is reading. എന്താണ് reading എന്നുള്ളതൊന്ന് familiarize ചെയ്യുക. Then you can put the time. Okay, maybe after 1 week. Clear? So yes, so what is in text A? So what is skimming and scanning? Speed reading plus scanning, which means grasping some of the contents or ideas from reading. That means you can underline certain keywords from each of the text. Okay, so we have 4 different texts here. One will be a pictorial of something for sure. Okay, no doubt one will be a pictorial of something. So here, as you can see, text B is a pictorial. There is a flow chart mentioned. Maybe a procedure item. What are the kind of procedures for the management? So likewise, yeah, one will be a pictorial of something. So coming to the text. Okay. And what about the number of questions? See, 1 to 7, which is called match the following. Okay. And 8 to 14, that can be called short answer questions. And the rest of the questions, which is 15 to 20, can be called fill in the blanks. Clear? Okay. Yes. Hi, Kavita. Good evening. So, yes, coming back to the question. So, I think I don't have to read the text because already you guys know how to do skimming and scanning, right? Okay. So, I'm just jumping to the questions directly. I'm starting with the first question. Okay. So, you guys can tell me what is your answer. Clear? Okay. So, question number 1. When should one consider surgical revision during the treatment of jaundice? But before that, let me remind you something. If you're a fresher or if you're a student who is attending this live session for the first time, you will get the material from our page called NEETU's Academy Reading. Okay, there is a page called NEETU's Academy Reading, and daily we will upload the materials before, I think, 11 a.m. Okay, so please do take the printout of the material, then read the material, apply skimming and scanning, and find out the answers. Okay, so yes, and the same will be uploading in YouTube. Okay, yes. So first one, when should one consider surgical revision during the treatment of jaundice? So what are the keywords here? In the keywords namukkulladu. So when, then surgical, as well as jaundice. These are my keywords from the question. So when you read a question, don't underline a group of keywords. Okay, and some students are like underlining the keywords in the they will underline like surgical revision, treatment of jaundice. Don't do that because you will get confused. Okay, so why we are underlining keywords? Keywords underline endina. It's not for a or ornamental side on the it is to understand what are the important words we have. Okay, അതുകൊണ്ട് underline ചെയ്യുമ്പോൾ it should be very clear. So what are the important words which I want? Okay. So those keywords should help me, will help me to find out my answer. So my keywords when, surgical and jaundice. These are my keywords from the question. Okay, so where is it mentioned? Surgical revision as well as treatment of jaundice. Yeah, where is it mentioned? Yes, a lot of answers. Yes, Divi, Kavita. Yes, Sudha. Okay, any other answers, anyone? No. What about the first question? Any other answers other than option B? Sorry, text B. No, it's B. Okay, so very good. Answer is mentioned in text B. So I'll show you the answer. Where is it mentioned in text B? Okay, so text B, in text B, as you can see here, this is all about, I'll give you a gist about the paragraph, okay? I mean the text. In text A, it's all about what is the condition and what about the prevalence. First paragraph is all about what is the explanation of biliary atresia, and second paragraph deals with the prevalence of biliary atresia. And in text B, it's all about, as I already mentioned, this is all about a particular, a flow chart is mentioned here. It's all about the procedure, okay? And jaundiced infant, what is the procedure they will do? And what about text C? It's all about what are the symptoms of the condition, as well as in text D, it's all about post complications. Okay. And where is it mentioned in text B? In text B, yes, consider surgical revision. See, keywords from the question. So when you can consider a surgical revision, if the child is having jaundice and it is unresponsive to medical treatment, then you can go for a surgical revision. Okay, so answer is mentioned in text B. That is the correct answer. Clear? Alright, so what about second one? Yes, Priya, Monita, yes, Sudha, Kavita, Divi, very good, answer is correct. Okay, second one, instances that forcefully make the children have liver transplant. So my keywords, instances, children, and transplants, yes. What about second question, guys? Second one, instances that forcefully make the children have liver transplants. Yes, Megha. First one is text B. What about second one? Instances, children, liver transplants. Yes. All right, Kavita and Sudha, it is mentioned in text A. Very good. Correct answer. Yes, Priya, which is mentioned in text A. Very good. Right answer. Okay. And where is it mentioned in text A? So the condition of, yes, child that is affecting their liver, which is from the second paragraph, a slowdown or stalling of bile flow, that is cholestasis, and affects your baby's liver and all the organs and tissues surrounding it. Bile clogs up in your baby's liver and causes scarring that can prevent their liver from working normally. Also, their intestines can't receive the bile needed to break down nutrients and support their growth. Researchers estimate, then it's all about the prevalence. Okay, it's about the estimations. For example, yeah, then example is mentioned there. So answer is mentioned in text A. As well as in the first paragraph also, there is mentioning about liver transplantations, right? Yes, so answer is mentioned in text A. Then, what about third one? Yes, Devi, Monita, Megha, Priya, Kavita, yes, Sudha. Answer is from text A. Very good. Third one, common abnormalities found in children who have recently undergone surgery for biliary atresia. My keywords, abnormalities, okay, and surgery. Yes, only two words I'm underlining, abnormalities as well as surgery. Yes, what about third one? Okay, is it C, Divi? No, C or no? No, it is from text D, common abnormalities found in children who have recently undergone surgery for biliary atresia. Yes, in text C they have mentioned some symptoms that is complicated for them, but still something after the surgery it is mentioned in text D. Post complications. Post-operative complications include. Okay, so what are the, yes, abnormalities after the operation or after the surgery, which is mentioned here in text D. So we have 4 different points for the complications. Okay, so answer is mentioned in text D. So how many correct answers? Yes, Priya, Monita, Kavita, Megha, Sudha. Yes, very good. Okay, so that is the correct answer. Then fourth one, where can we find the maximum number of babies with biliary atresia? So where maximum number, yes, no number I'm marking, I'm just marking babies. So yes, what about fourth one? Where can we find the maximum number of babies with biliary atresia? Yeah, fourth one. Yes, very good, Sudha. Yes, Tanga, Sudha and Megha. It is mentioned in text A. Very good. It's from text A. Yes, Priya. Yes, Shanta and Sankita. It is mentioned in text A. Hi, Sankita. Yeah, so that is mentioned in text A. Okay, so where is it mentioned in text A? Maximum number of babies with the condition, the prevalence of the condition, the estimation of the condition, which is mentioned here, which is 1 in 12,000 babies born in the US, 1 in 6,000 babies. So that prevalence or this condition is affecting babies, which is mentioned in text A. Okay, then fifth one, yes, Monita, Divi, very good, correct answer, text A. Fifth one, the most predominant indicator of biliary atresia. So most predominant indicator which means a symptom. Okay, so where they've mentioned about the symptoms and the most predominant indicator. So without even reading the paragraph, if you have already underlined the keywords, definitely your answer will be it is from text C. Fifth one is C. Okay, so this is the most predominant indicator. Okay, the first signs of biliary atresia usually appear a few weeks after birth and include jaundice, pale poop, dark or amber colored pee. Okay, so likewise we have a set of symptoms mentioned initially or the predominant signs, as well as here the most obvious sign again. So that's all about text C. Then sixth one, the treatment measures that are tried and failed in the management of cholangitis. Okay, so how many correct answers? Yes, Divi, Shanta, Priya, Kavita. Yeah, very good, correct one, C. Okay, so already we got 1, 2, 3, 4, 5 marks, right? Yes. So jumping to the sixth question, the treatment measures that are tried and failed in the management of cholangitis. So treatment, tried, failed. So where is the treatment mentioned? Already they have done treatment for this, but it's they tried and failed in the management of cholangitis. So we have another keyword here, which is cholangitis. So either you can mark tried or failed, and then you can underline cholangitis. Yes. Okay. Yes, Kavita, Shanta. Yes, Priya, which is mentioned in text D. Very good. Okay, because the complication is mentioned here, cholangitis. So what are the problems after that? Cholangitis is reported up to 50% of cases. Surgeons have tried some surgical maneuvers in the past in an attempt to reduce the risk of cholangitis, but none of the maneuvers have proved successful or useful. Okay, and that's mentioned in D. Seventh one, why wouldn't the children with biliary atresia fail to gain enough pounds? Enough pounds, which means weight. Oh, okay, they are talking about weight here. So children fail gain. Yeah. So where is the problem of weight gaining mentioned? Either textual, where is it mentioned? Yes, Kavita, very good. Your answer is correct, which is mentioned in text C. Okay. Yeah, text C. Kanda, when you write your exam, ningala exam hall irikkumbo, you can hear my sound. For sure. Alle, adoru truth aanu. Kaaranam endana, when you sit in the exam hall, you can hear the sound. Yes, I was talking about this is a guideline, this is a manual, this is a policy. This is how you should underline the keywords. And where is the keyword? Where is the text mentioned? What is the missing word? The question is starting with when. So, like kind of that remembering should be there. Alle, nammal orkanam, inganeyirunnu paranjathu. Live il ingane paranjirunnu. So, angane paranjirunnu. Idella nammade mind il varanam. So, answer is mentioned here. Evideya? Seventh one. Text C. Why wouldn't the children is not avarku weight in the karyana parayunnu because it is mentioned here. Trouble gaining weight, kind of failure to thrive as nutrients are not getting absorbed. Okay, so answer is mentioned in C. Yes, 7 out of 7. Okay, yes, Shanta, very good. Kavita, 7 out of 7. Kanda. Okay, very good. So coming to 8 to 14 short answer question, you can answer in a word or a short phrase. The important instruction here. Okay, very good, Mega. 7 out of 7. Excellent, dear. Yes, okay, Sudha, yes, it's 5. Yeah, pretty good. It's okay. Next time you can score 7 out of 7. Okay, Priya, 7 out of 7. Very good. Yeah, so 8th one. What procedures could be executed to manage active bleeding post to 𝐒𝐴𝐳-portoenterostomy? So my keywords, procedures, executed, portoenterostomy. Okay, yeah. So what is the procedure? What procedures? Question is all about what procedures. So procedures, plural is mentioned there. So we need not one procedure, we need 2. Okay, so what are the procedures mentioned? The procedure ആണ് അവർ ഉദ്ദേശിക്കുന്നത്. The procedures executed to manage active bleeding post to, yes, the condition 𝐒𝐴𝐳-portoenterostomy. Yeah. So where is it mentioned? Endoscopic surveillance ആണോ? It's not procedures, right? We need procedures. Yeah. Sclerotherapy or bonding. Don't write sclerotherapy and banding. It is sclerotherapy or banding. You can put a comma, that's fine. Think of a comma, it's okay. But don't write sclerotherapy and banding. It's wrong. Answer is mentioned here in second last bullet point. Those with an active bleed require. Okay, those with an active bleed require sclerotherapy or banding procedures. You can either put a comma or you can write or there. Clear? Yes, sclerotherapy or banding. Yes, Divi, correct answer. Yes, Priya, Kavita, yes, Monita. Yes, Shanta, it is sclerotherapy or banding. Very good. That is the correct answer. And what about question number 9? A substance produced by the liver that carries waste products to their intestines. So my keyword, substance, then liver, intestines. So what is the name of the substance that carries waste products to their intestines? That substance aanu. Yes, that substance is called bile. B-I-L-E. Bile is the substance. Bile is a substance your baby's liver produces that carries waste products to their intestine. So answer is bile. Alright. Yes, Shanta. Yes, Monita. Kavita. Yes, Divi. Mekha. Yes, Sudha. It is bile. Very good. Very good. Answer is bile. And question number 10. The post-surgical complication of biliary atresia accounts for around 1 in 2 of patients. So my keywords, post-surgical complication 1 in 2. 1 in 2, which means 50%. As in, it comes with percentage, that means 1 in 2, 50%. Alle? Okay. So yes, what is the correct answer? Post-surgical complication. So what is the post-surgical complication that comes with 1 in 2 of patients or 50% of patients? Okay, very direct answer. Yes, cholangitis is reported in up to 50% of cases. Okay, the complication is cholangitis. Yes, Divi, Monita, Kavita, yes, Tankasudha, it is cholangitis. Yes, Shanta, cholangitis. Very good. Okay, and question number 11. How long should jaundice last in child that actually calls for immediate medical intervention? So, how long? And child, then medical intervention. Yeah, so these are my keywords from the question. How long, then child, medical intervention. Yes. We need the time, duration, how long, which means the duration they are asking for. So, what about the duration is mentioned here? Yeah, so what duration is mentioned? It is mentioned, I think, in second text C. Yes, and I've seen it here in text C. If your baby has jaundice beyond 2 weeks after birth, it is important to take them to see a healthcare provider right away. Okay, very good. So answer is mentioned in here. Answer is beyond 2 weeks. Okay, answer is beyond 2 weeks. Yes, correct answer Megha. Yes, Sudha, answer is beyond 2 weeks. Exactly 3 words. 1, 2, 3. Beyond 2 weeks. Yes. Okay, 12th one. The medical term given to abnormal poop of a child with biliary atresia. Yes, so my keywords, medical term, abnormal poop. Okay, so what is the medical term for that? It is? Yes, Divi, correct answer. Yes, Kavita, beyond 2 weeks. Yeah. Yes, Monida, correct answer. Beyond 2 weeks. Yes. What about the next one? Yes. Please be careful about the spelling. It's not alcoholic. It is echolic. Okay, it's echolic stools. ACHOLIC. That is mentioned in the passage, which is again in text C. Okay, see. Babies with biliary atresia have poop that's light beige or pale in color. Healthcare providers call these echolic stools. It's not alcoholic. Okay, don't write the spelling incorrectly. It is echolic stools. Yes. All right. Yes, correct answer. Priya, Kavita, Divi, Shanta, Megha. Yes, Sudha. Correct answer. And what about 13th one? Prevalence of biliary atresia in Taiwan. So, prevalence and Taiwan. So, prevalence, a very simple question which is mentioned in the second part of text A. And in US, it is 1 in 12,000. In Taiwan, it is 1 in 6,000. So, very direct answer, 1 in 6,000. Okay, answer is 1 in 6,000. Then, 14th one. Ultimate method to be adopted even if the surgical revision turns out futile. So, ultimate, final, method, then futile, not getting better, no improvement. That is futile, which means. So, what is the correct answer? Yes, Kavita, it is 1 in 6,000. Yeah, so what about 14th one? 14th one, if there is nothing, no improvement is there, then you can go for a transplant. Okay, so answer is mentioned in text C. So, if there is no improvement, if it is futile, then you can go for transplant. That is the correct answer. Okay. Then, we are just jumping to fill in the blanks. So, find out which word is missing there, or you can find out which words are missing. Treatment should be prompt and aggressive with broad spectrum intravenous antibiotics with good coverage against dash. So, my keywords, aggressive, broad spectrum and coverage. Yes. What about question number 15, guys? Any correct answers there? And hyphenated word should be hyphenated. So here it is gram-negative bacteria. Okay. Yes. Gram-negative bacteria. And see, once again, I'm reminding you, maybe you'll get a lot of fake messages from fake people as well as fake institutions. Please don't fall for that. Please just report and block. Okay. Yeah, so 15th one. Aggressives, broad spectrum and good coverage. Yeah, so what is the correct answer there? It is gram-hyphen negative bacteria, which is mentioned, I think, in text D. I've seen here the name of the bacteria, which is in text D. Where is it mentioned? I think here. Children with, yes, treatment should be prompt and aggressive with broad spectrum intravenous antibiotics with good coverage against gram-negative bacteria. So this is the correct answer, which is gram-negative hyphen negative bacteria. Hyphenated word should be hyphenated. Okay. Yes. Then 16th one. Researchers estimate that biliary atresia occurs dash babies born in the US. So researchers, then babies, US. So we already know the prevalence, right? In Taiwan it was 1 in 6,000 and here it is 1 in 12,000. Without even reading, I know the answer. Okay, so which is 1 in 12,000. Is it 1 in 12,000 or 1 lakh? Yeah, 12,000. Okay. Then 17th one. Children with biliary atresia will have a swollen belly due to. So children, swollen belly. So why there is a swollen belly? Due to? It is because of fluid buildup, right? Yes. Where is it mentioned in text C? Swollen belly due to fluid buildup. A very direct answer. See, fluid buildup is the missing words. Okay, these are the missing words. 18. Portal venous pressure is high in the majority of infants with biliary atresia due to. So portal venous as well as pressure, or I'm just marking high. Okay, due to what? What is the correct answer here? Okay, which is mentioned here in text D. And I think portal hypertension is mentioned here. So portal venous pressure is high in the majority of infants with biliary atresia due to liver fibrosis. So answer is liver fibrosis. Very good. Divi, yes, Sudha, liver fibrosis. All right. And 19. Dash can be done initially if a bile drainage is in progress and no trace of jaundice. Okay, so dash can be beginning of a sentence. First letter should be capital. So what is the correct answer here? You can go for a follow up. See? Okay, bile drainage, anicteric. So you can go for a follow up. So answer is follow up. And the last question. Bile clogs up in your baby's liver and causes dash that can prevent their liver from working normally. So bile clogs and prevent normally. So what is the correct answer? And I think it is mentioned in text A. Already I've read that line. Okay, scarring. Something is mentioned. I think it is here. Yes. Bile clogs up in your baby's liver and causes scarring. That can prevent their liver from working normally. So answer is scarring. Yes. Yes, Priya. Yes, Devi. Scarring. Yes. Any other answers other than scarring? No, right? Okay. So anyone with 20 out of 20? 20 out of 20 undo? No. Okay. Yes, so that's that. So take care. Thank you. See you tomorrow.